Today's case is another case of osteomyelitis. A man with osteomyelitis in his leg who had a fracture a few years ago, had osteosynthesis, a plate and screw fitted, but it ended up getting infected and causing some local problems. So the idea here today is to carry out the treatment we always do. We're going to open up the scar, remove all the infected tissue, we're going to remove the plate and the screws, we're going to make a window in the bone, remove all that osteomyelitis, clean it, check inside, put products in it to remove any remaining bacteria. Today's proposal, we're going to cement the dead space, cement with antibiotics, that cement that we enrich a lot with antibiotics. And at the end, we're going to do a plastic wrap to close it up. The advantage of his case is that the bone is consolidated, so he'll even walk out of the operating room without any problems. At the end of the recovery, we'll put a vacuum bandage on to stimulate healing, and we hope that we'll see a cure for his problem, for the infection. So you're going to see a very interesting case here. So here is a more modern way of brushing our hands. We don't use brushes anymore. There are countries in the world that don't use them. They don't even have sinks anymore. So we use this product here, which is an imported product. It's a German product, some are Swiss. And you disinfect your hands. So what's the advantage here? Firstly, the product kills bacteria. And the act of brushing, it ends up hurting the hand. We don't see it, but it makes small wounds. And this also tends to increase infections and is also bad for the surgeon. These products here are tried and tested products, so your skin doesn't suffer and you don't start carrying bacteria up and down your body. So I've only used these products here. When I lived in Germany, there wasn't even a sink. You could only use this kind of sweat. I'll help you give it a good bath. The important thing is to always wash your nails between your fingers. I call this part here the commissure, the part between the fingers. And that's it. Now we wait for it to dry. Hands ready, let's go. Can you imagine yourself like this with a loose back? No, it's nice. We get some meat, eh? Thank you. This cement is the one we use routinely. It's a cement with antibiotics. It's green. It's the pioneer of cements. It's been around since the 1960s. And it already comes with gentamicin. Then I add more vancomycin and meropenem. And we use it for two purposes, basically. 3, to fill dead space, to give structure. In other words, it replaces the bone and it releases the antibiotic to treat locally. So we kill several birds with one stone with cement like this, okay? And this is the best quality. There's nothing better in the world, which is what we value in our surgeries. So the surgery has now finished exactly as planned. And now comes those things we always talk about, which is the cat's sleeve. So there it is. The fellow plastic surgeon is closing it in layers, removing all the dead space with all the delicacy of the warm parts to get the desired result that we want. At the end, we'll put on a vacuum dressing to make sure there's no dead space left, stimulate healing, protect the wound, and get the desired result, which we want to resolve. We don't want to go back with this patient, have to operate again. The idea is to resolve it once and for all and restore the quality of life he deserves. Guys, here's something else we always talk about in the videos, and here we're going to show you today. 12 fragments for culture. So we take the material, ideally the material closest to these plates that are here. We put it in special jars and send it to the lab as soon as possible. And I always send a lot of samples. And precisely, there's always a percentage of them that come back negative. So we exclude that. And this material that we took, these plates and screws, we also send it for analysis using something called sonication. So there's a device that's able to break down the biofilm, the bacteria that are on the plaque, and do the culture. Ideally, they should always be similar so that we know it's the same bacteria and direct the treatment. So this is part of the procedure, and it's a very important stage. It has to be done using a very specific technique. Well, to finish off, we put on the vacuum dressing, which is here. It's a special dressing, plastic, so it's a different sponge connected to this machine. It makes a negative pressure, it makes a vacuum, it pulls. And this seals the wound, and this vacuum brings the blood to the edge of the wound. So you stimulate healing. It's excellent for cases of infection like this, and especially post-plasty, to guarantee the outcome of the procedure. So it's routine for us to always do this type of dressing at the end. The patient will have it here for a week, and at the end, in my team, we have a nurse who specializes in this type of dressing, and we evaluate it. If there's a need for it to stay longer, it does. But as a rule, a week is enough. The result is what we always want from the program. Now the surgery is over. We take it all away, and it's time to tell the family that everything went perfectly.